Okay, so the CVSA office support called moderators or support group pages, online platforms. We see a good amount of people with PTSD
Yeah,
and CVS, and I'm sure, this is not, one age group or another. This is another one that's kind of across the board, unfortunately. So, do you also experience a correlation with that?
absolutely. And I think for a lot of kids and people with CVS, it kind of falls more into the medical trauma aspect. So you've got these symptoms and these really kind of, you're very sick, and some people don't believe you. Or you're in the hospital and they're kind of working you up for lots of things that may or may not have been giving you relief. And so it's kind of like this balance of, um, from the medical provider's perspective, of what can we do to help you if we don't really know, um, versus kind of let's validate and kind of get you through the episode. Um, I think it's really challenging because in the moment, a lot of the trauma aspect isn't at the forefront, but then it's the overtime and some of the guilt that you were talking about, and like, wow, like we did that, and this really impacted me, and maybe it comes out in small ways, like, I'm really nervous to go back into the hospital. I'm nervous about the next episode because I don't want that to happen again. But I think that's a great thing to talk through with a therapist, especially one who might have some expertise in working with chronic illnesses, because I think kind of how it shows up in CVS is unique, but across chronic illnesses, the medical trauma piece is there for sure.